Amniocentesis is a medical procedure conducted during pregnancy to retrieve a small amount of amniotic fluid and cells from the amniotic sac surrounding the developing fetus. This procedure is typically performed between weeks 14 and 20 of pregnancy. The amniotic fluid serves as a protective cushion for the baby, and it contains cells shed by the baby, which hold vital genetic information. There are several reasons why amniocentesis might be recommended. 1. Genetic testing. One of the primary purposes of amniocentesis is genetic testing. The collected amniotic fluid contains cells from the baby that can be analyzed to detect genetic conditions, chromosomal abnormalities, or single gene disorders. This testing can be particularly useful when other prenatal screening tests, like the first trimester screen or prenatal cell-free DNA screening, indicate a high risk for certain conditions, such as Down syndrome. 2. Diagnosis of fetal infection. Amniocentesis can also be used to detect infections in the developing baby. It helps identify certain illnesses, such as fetal infections, which may require appropriate medical treatment or management. 3. Treatment for polyhydramnios. In some cases, amniocentesis is performed to drain excess amniotic fluid from the uterus when there is a condition called polyhydramnios. This condition occurs when there is an abnormally high amount of amniotic fluid, which can put pressure on the baby and the uterus. 4. Fetal lung testing. In rare cases, amniotic fluid might be tested to assess the maturity of the baby's lungs. This information is important when delivery is planned before 39 weeks of pregnancy, as it helps determine if the baby's lungs are developed enough for a safe delivery. Genetic amniocentesis is particularly significant because it provides valuable information about the baby's genes and can influence decisions regarding the management of the pregnancy. It is often offered to pregnant individuals for whom the test results could significantly impact their approach to the pregnancy. During the procedure, a healthcare provider uses ultrasound to guide the insertion of a thin, hollow needle through the abdomen and into the amniotic sac. This ensures precise placement and minimizes the risk of injury to the baby or the uterus. While some people may experience mild soreness or cramping during or after the procedure, most individuals report minimal discomfort. After the amniotic fluid is collected, it is sent to a laboratory for analysis. Some results might be available within a few days, while others may take several weeks to process. Though amniocentesis is generally considered safe, it does carry some risks, albeit they are relatively low. These risks include leaking amniotic fluid, a slight risk of miscarriage, about 0.1% to 0.3%, needle injury to the baby, and, very rarely, the possibility of infection. Healthcare providers take every precaution to minimize these risks and ensure the safety of both the parent and the baby during the procedure. The decision to undergo genetic amniocentesis is a deeply personal one. Expectant parents should have a thorough discussion with their healthcare provider or a genetic counselor to fully understand the potential benefits and risks. These professionals can provide support and guidance throughout the process, ensuring that parents are well informed and prepared for any outcomes that may arise. Overall, amniocentesis plays a crucial role in prenatal care, enabling parents to gain valuable insights into their baby's health and empowering them to make informed decisions about their pregnancy journey.